Okay, so let's have a look at this one. Pedunculated failure. Yeah, that's a nice word actually. I think it's one of my favorite. It's one of my favorite. I like interceptions, not for people, but I quite like that word. And yeah, pedunculated is a nice word as well. Nice way to describe things. Okay, so this is something that it looks a bit spooky, doesn't it? It's a skull. And I think in the beginning it can look a little bit scary because you can't really sort of undress the picture with your eyes, as it were. But what you have to do as you get used to it is to really try and draw out the anatomy that you know. So you know the eyes are around here. You got your nasal septum. You've got your maxillary sinuses here, and you got your ethmoid sinuses over here. And what you start to notice, okay, so that must be a whole load of sinuses. And the same as over here, these are the mastoid air cells right at the back over here as well. So that's all the aerated stuff that you would be looking for. And actually, just here you can see the frontal sinus as well. So they all look okay. We're not particularly worried, but they've done this facial view, right? So one of the things I would be looking for in a facial view is definitely to look for when there's any fluid within the maxillary sinuses, because sometimes if you've got a significant fracture of the maxillary sinus wall or the orbital floor, then you can get a lot of fluid sitting there, and that could be a bit of a telltale sign. I would always look for a bit of herniation of intraconal fat as well. Sometimes that can happen. Is someone a dentist here? So wisdom teeth hasn't moved down. Um, yeah, so wisdom teeth, I wouldn't really go for the wisdom teeth on this one. Ideally, you want to get an OPG if you want to be looking at the wisdom teeth, because you get a really nice view of the teeth and the mandible, and you can see whether there's any dental caries or anything like that. So I really look at the dentition. And this one is going to be difficult to be 100% sure as like what's upper jaw, what's lower jaw, and whether tooth have unerupted or not. So we'd normally say a tooth is erupted, like a volcano, you'd say erupted or unerupted, right? So when you're looking at pediatric ones, they're normally unerupted wisdom teeth, right? In an adult patient, you probably wouldn't mention it, just that they've got full set of teeth. But yeah, someone has come out with it, and yeah, what you do actually have to follow the mandible all the way around, like so. And generally speaking, they do say that the mandible is like a polo. So for those that don't know what a polo is, it's like a mint, and the mint is like a circle. So they've got this hole in the middle of it, and then the rest of it's like a mint. And they used to, I don't know if they still do this, but they used to sell the middle bit as well, called polo holes or something. But they say that when you break a polo, you don't break in one place, you break in two, because it's a continuous loop. And so it's the same thing with the mandible, because it's almost like a continuous loop, and you normally get a fracture in more than one place. But having said that, in truth, I have seen fractures in one place. Same with the inferior and superior pubic rami. Sometimes you get a unilateral kind of one area fracture, but it's something to be aware of, that if you do see a fracture, you should really look for a second one if you're not looking for a second one already. But if you compare this side with this side, you can see that this looks very, very jagged, looks slightly out of place. And exactly like someone said, it does look like it's the mandibular neck. That's going to be the condyle over here. The mandibular neck does look it looks fractured, doesn't it? And looks slightly out of place. So they're probably not able to close their jaw at all, this poor patient. But anyway, that's a bit of a spooky case with that nice little picture of a skull. Right. So